Hi folks, I'm Dr. Paul. I'm his dad, Big No-No's dad, and it is an honor and a privilege to be on his channel and sharing with you this update. This is 48 hours almost to the minute after he got out of his surgery. If you're checking in for the first time, it was 3 weeks of incredible abdominal pain, the worst of his life, that led him to the ER, where they very quickly were able, thankfully, to diagnose a first through CT scan, but then colonoscopy, and they found a tumor in his colon right near the cecum, and immediately knew that it had to come out. So next day, basically almost Monday, which was 48 hours ago, he had surgery, hemicolectomy, which is taking the ascending colon from the right lower side of his abdomen up to where the liver is. They removed that and 10 inches of his ileum, the small intestine, and got all the tumor. We're good there. We're just waiting on official pathology stuff. But they all talked about this being a major surgery.
And they talked about it being a cancerous tumor,
correct,
without being able to prove it.
Right.
Just based on the way
how
it looked.
Yeah, they were basically said it's malignant colon cancer. So you can imagine that's a shocker for a 37-year-old, right?
Yeah.
Yeah. Hey, I got his age right. I have too many children. It's hard to keep it all straight.
True.
But he was number one birth child, so hard to forget that day. Back to the story at hand. Sorry for the digression there, son.
No, it's good.
Okay. Yesterday, when the surgeon came in and gave us the details, he showed us pictures from the surgery. Was quite, the crystal clear pictures of his liver, which was just beautiful, smooth, shiny, the right color, pink. I've never seen such a good looking liver.
Yeah, it looks really good.
It was impressive.
I was pleasantly surprised by how good that looked.
Yeah, I was like, wow.
It looks like the kind of liver you would model if you wanted to show someone.
You could be a liver model.
And this is fun for me, at least. I imagine amusing for you too, in that I'm a recovering alcoholic, and I've documented that on the channel, and it's nice to see that my liver is doing well.
Yeah.
Oh, and I think also to be mentioned, I think he brought this up to say that they didn't see any tumors or
nothing to worry about on the liver,
right,
or anything they looked at.
And that was also per the CT scan, but I think he also said visually it looked good.
Yeah. An anecdote, just for the heck of it. The surgeon was so happy to do this surgery. He said this was the nicest surgery I've ever done, because there's no fat. So he had never operated on somebody in the fitness level of that you have.
Yeah.
Yeah. And then there was another funny comment. He says, "You see this mound right here?" He says, "That's his abdominal muscle. I have never seen such a large abdominal muscle. Usually it bows the other way."
Yeah, people have been getting a kick out of that part, me just being a more fit person. And I think especially when the juxtaposition is the cancerous tumor that they were fishing out.
Right.
So it's just an unusual pairing.
Definitely.
Which has really humbled me.
I imagine, and you've been very appropriately humble.
Yeah.
That's your story to share for sure.
So back to the doctor's update.
Back to the update. So one of the pictures he showed us, which was fascinating, was, Noah's incisions, and I think we showed you last time, above his belly button, there's about a 3-inch at the most, little incision. Through that incision, they had 3 other holes that they were doing laparoscopic to visualize. They pumped air into his abdomen, and then that's what allowed them to really look around very carefully. But they pulled out of that little hole most of his enlarged intestine, at least the part they were needing to work on, and the ileum that they were needing to work on. So now it's sitting on the outside of his belly. If you've ever seen surgery, they always use these blue cloths, almost like a hand towel. And so we see the picture of his large intestine and his ileum sitting on top of this blue hand towel outside of his abdomen, and then they showed their plan was to take the blood supply that led to the tumor along with that part of the colon and as much ileum as they needed to feel sure that they got it all, and that what's left all had adequate blood supply. So it's fascinating how they did that. They injected a dye,
right,
and it lit up green, and he could see here's where the green starts for the colon we're going to leave in him, and here's where the green starts for the small intestine, and we're going to cut right here so that we've got fresh, nicely blood perfused colon and small intestine. They lay it together side by side like this, sew up the ends, and then make a little opening between, and that's how they do it. It's not like here's one and they don't. It's not end to end like that. It's side by side.
Because the diameter wouldn't fit.
They're not the same diameter.
They're not the same diameter, and I think, correct me if I'm wrong, but you said that you didn't necessarily realize that they would pull out the intestine to do that fine suture work to then put it back inside the body.
Yeah, once I saw it, it made total sense.
It made sense to me too.
I didn't know that's what they were doing. I was in my mind going, boy, this robotic surgery must be difficult to think about, being down through the abdomen, looking on a scope. And I mean, surgeons do this, and doing fine suturing. So I felt a lot better about the ability to do a really good connection, since it was right there in front of them.
Yeah, that's cool.
Yeah, so very cool.
So all in all, he said the procedure went very, very well.
Very well. The tumor itself did not extend visually beyond the abdominal wall.
Yeah, if I may jump in.
Yeah.
One of the original things that they suspected, per my CT scan on Thursday when I was admitted to the hospital, as my dad said, after the 3 weeks of increasingly worse stomach pains, was that they believed I potentially had Crohn's disease based on the way the inflammation looked in the terminal ileum, which is that end of the lower intestine, correct?
Small intestine.
Small intestine, excuse me. He told us that when he got there finally, because they couldn't see it during the colonoscopy due to the obstruction of the tumor, that it was not in fact Crohn's disease. He believes it was just inflamed because of the partially blocked or the partially obstructed intestine due to the tumor. So I don't have Crohn's disease, which I thought was obviously a small silver lining.
Sure.
I mean, I guess. If I may also jump in and then elaborate, please. He also said that they collected all of the nodes, and I'll have him explain what that is, what is a node, but they collected the nodes, and that he did notice that they were in fact inflamed. If I'm understanding cancer correctly, when you have a cancerous tumor, as they believe I do or did, it will have the potential to spread that cancer to nodes within a similar blood supply initially. They took all of those out, and they will all be biopsied. And he described the pathology process as cutting them up almost like you were slicing vegetables, sending them out for testing to see if cancer had spread to those nodes. If cancer has spread to those nodes, without being able to explain specifically what the regimen would be, he was saying that I would likely, if not certainly, need chemotherapy and maybe radiation, but I know he used the word chemotherapy. He said either way I would need to see, what would you call a cancer doctor, Dad?
Oncologist.
An oncologist either way, but that whether or not those nodes had accrued any cancer would be a huge marker or make a huge difference as to what the treatment plan would be. Would you please let everyone know what a node is, if you can explain it?
Sure. So the lymphatic system is a whole separate system of vessels that are connected to lymph nodes, and it's how things move back into the bloodstream throughout the body. Most of us know that when we have a cold, we'll have little lumps in our neck. Those are lymph nodes. And we also have lymph nodes in the groin especially, but also throughout the abdomen. And so it's the lymph nodes that were associated with that part of the bowel that were inflamed. And he showed us a picture. One of them looked, I mean, it almost looked like an egg. It probably wasn't that big because it was perhaps magnified for the picture.
Right.
But no, you said it exactly right, Noah.
Okay.
I mean, that's managing colon cancer, and some of you viewers, I know you're already sharing your experiences. Thank you for that, because everything helps.
Yeah, it does.
For Noah, as he goes into phase 2, they got everything done. He's reattached. It all went well, but there's still that underlying decision, right, that he and his oncologist will make is, do we do chemotherapy or not, and what else might we do? I'm a holistic doctor, retired pediatrician. I don't diagnose or treat, but there are a lot of alternative things that people can do as well, and so I imagine some of you watching will probably share your experiences, and we're open to all of that.
Yes, we certainly are. They said that as far as they called it types of cancerous or cells that may have migrated beyond my body, or excuse me, beyond the localized tumor, depending on the nodes, and that you can't see them. And that is the idea behind chemotherapy, even though the CT scan
Right.
is showing that unclear.
Yeah, most cancers will have what's called metastasis, where cancerous cells can get into the bloodstream, go anywhere in the body, and each cancer type has certain areas that are more likely for the metastasis to happen, which is why they did the CT scan of the chest. That's a very common place for colon cancer to go to the chest
Lungs.
or the lungs, liver.
And they did the abdomen and pelvis as well.
Right.
Yeah. So let's move on from that, unless there's anything else in
No,
your
that's
mind.
good. You have an interesting update, because when I left you yesterday, a little after 24 hours post-op,
Right.
you had not a single fart. Your bowels weren't really even gurgling.
No.
And so you were in this condition where you would just had to wait, and you were still having a significant, we had been chasing the pain.
Yeah, so when we last left you, that whole yesterday's mission was to get my pain more under control. I had what I think could fairly be described as a really hard first 24 hours as far as pain management, and thank God that you were here, and then everyone here has been great, and we got through it, and it was we got through it, and I'm grateful. But day 2, being yesterday, leading up to today, it was all about getting my pain more under control, being a little more thoughtful about managing the time frame between using oxycodone and, as needed, some Dilaudid, which is an intravenous narcotic, and then we did incorporate some muscle relaxers. I think we mostly did a good job yesterday. I felt pretty good, maybe a little over sedated for a moment, leading to some sense of confusion or listlessness, maybe, if I'm using that word right. But we found a balance, and by the end of the evening, I maybe started feeling too good, for lack of better words, in that I walked for about 45 to 60 minutes yesterday, just in hopes of speeding up the motility of my intestines, and in hopes of passing gas, in hopes of increasing my chance of going home sooner. I just felt pretty good, and I was really encouraged by that.
CrossFitter, you're always going for the gusto.
Maybe overwalked a little, but had a good day yesterday, all things considered. Managing pain and my mental health, all things considered, a good day. I did find myself in a bit more pain than I meant to be in the later part of the evening. They were kind enough. I didn't eat anything, but I did consume about 45 ounces of bone broth and a couple cups of Jell-O, and I was just so pleased to do that. I haven't eaten much of anything in the last, let's say, 7 to 10 days, and so it was the first few hundred calories I've been able to slowly get in. But to bring you, unless there's anything else you want to add, to bring you to this morning, I had a very pleasant evening. We pushed some Dilaudid because I got behind on pain. I got a little too loopy feeling, not when my eyes were open, which was interesting, and we don't need to go on a tangent, but when I would close my eyes last night, it felt like I was falling through my bed, which I don't like. I certainly don't like the way narcotics feel, but I can tell that they help with pain, and so I stayed up, waited, and then we just slow played some Oxycontin throughout the night, and my pain was eventually in perfect harmony. I had a very peaceful night. They took me off my IV, which I'm currently back on, and I was able to freely go to the bathroom, measure my urine output. It was good. At 5:30 in the morning, I began to think I might be able to pass gas, and I was really looking forward to this. I tried pushing, but it wound up being a bowel movement. It was highly liquid, and it appeared to be predominantly blood in my stool. Dark, red, very thick, viscous blood, and it scared me for sure. I felt my heart rate spike at 5:30 because I just didn't even consider what would come out when I first had to use the bathroom. I felt my anxiety climb. I felt some lightheadedness overcome me. I took a deep breath. I alerted my mom calmly. She stayed with me last night. I called the nurse. She came in. They reached out to the surgeons. I wound up using the bathroom 2 more times. More blood, and perhaps even more bloody looking blood, but maybe that's just because we caught some in a hat. They did blood work on me immediately, but in a very calm fashion. No one seemed worried, and I was trying to stay nice and calm. I didn't want to dramatize the situation. I was saying my prayers and just trying to stay mindful that I'm well taken care of. But the surgeon came in, thankfully, about an hour later. She'd been meeting with me most mornings. I think her name is Dr. Chu, and perhaps Dr. Cho. And she explained to me that, and maybe I'll let you take over this part, what she explained to me. You just watched, maybe you can explain better what she said to me as to what was going on and how we decide if there's a problem.
Sure. Well, basically, she said it's completely normal and expected. Not that everybody has a lot of blood, but most people do, and the amount that he had was not in the least bit concerning to her. On our end, we know that we had this big decision to make 24 hours ago, which was, do you take another blood thinner? They were giving Lovenox. They had given a dose before surgery and then a dose 24 hours later. And we were debating, should we do this? So it's done. It's very standard of care to prevent blood clots in the legs that could then go to the lungs and give you a pulmonary embolism. And if you're post-op, especially post-op cancer, the data is strong. I mean, we looked at it. We're going, do we do this? And it seemed like, yeah, probably you should do it. Obviously, we're going no more Lovenox. He's moving. I mean, he walked like a lot yesterday. We don't have to worry about blood clots. We do have to worry about bleeding, in my opinion, given the blood in the stool. But what she explained is when you make the cut of the large intestine, small intestine, bring it together, cut it together, sew it together, that's blood vessels are there to that tissue. So it's quite conceivable you could have a fair amount of blood. Some of it's going to get into the intestines and into the colon, and just be sitting sort of waiting for the colon and the intestines to start moving. So what we wanted to happen is happening, and
I probably had 6 bowel movements.
Yeah, some of them are just little smears.
The last couple were pretty significant.
Yeah.
They all still look like blood, but it's a little bit of brown and yellow.
Starting to look a little brownish.
A little brown and yellow. So I'm just keeping the faith that if they say that's normal, they did my blood pressure, it was okay. My blood work came back, and there's nothing suggesting I would need a transfusion, let's say. So that's good, because I started to have those thoughts like, okay, God, if maybe I need emergency surgery, maybe I ruptured an intestine or something. I played the tape a little bit in my head, and I tried to stay calm, but I'm thankful to say it doesn't appear at all to be what's going on. The surgeon seemed so mellow about it, and she observed the bloodiest looking one and wasn't impressed, so that's good. I suppose, which is great news. And worth anyone else who's going through something like this to be mindful that you might have blood in your stool, and for a while. Come on in, baby. So
you can get on video if you want.
Yeah. The last thing that we'll go ahead and say is that this morning I was really excited for my day, and I decided, based on how well the night had went symptomatically speaking and energy-wise and pain-wise, I would go with my dad and my mom to get some coffee, just walk a little bit in the hospital to get there. I didn't make it very far, and I began to feel very lightheaded, and I began to think I might faint, and luckily my dad was able to get me some water, and we threw down a couple salt packs real fast, put me in a wheelchair, and quickly walked me back.
While your mom was getting you your
My mom was
that you
giving
really
me my
wanted,
coffee,
so,
yeah. I had this whole idea of how today was going to go.
We were supposed to go sit there and enjoy coffee.
And just
you
chat.
Still got your coffee.
I still got my coffee.
Thanks,
so
Mom.
it was a little reminder that I'm still 48 hours post-surgery, that maybe I wasn't ready to be off IV fluids all night. Who knows? I was doing my best to drink. But just to take it easy is my lesson from that. I still haven't eaten yet, but I think that's about to change. I'm probably about to have my first bites of food. But they gave me some Zofran for some sudden nausea. My dad helped me keep me upright while I used the bathroom a bunch, and they hooked me up. I got back into my gown. My brain.
You're hooked up because you were low on phosphorus.
I'm hooked up because I was low on phosphorus. So anyway, we're doing okay, and my spirits are okay, and my brain function is coming back a little bit. I felt very, very suddenly out of it.
Jesse walks in the room and his brain function gets better.
Yeah, my wife just got here. Do you want to stay off camera, baby?
Yeah.
Okay.
She's good.
Hi.
Yeah, just say hi.
She says hi.
So that's where we're at now. It's about to be 1 o'clock. I'm gonna have my first meal. Thank you guys for all the well wishes and the kind words and being so loving towards my dad and encouraging towards me, and for sharing your testimonies. I continue to just check the comments, gain a lot of calm and support from you guys. Like, I don't even know what to say. It's so nice. And we'll just see how it goes from here. The goal is to ingest a little bit of some simple solids and hydrate and rest and manage pain. And I'll try not to get quite so ahead of myself like perhaps I did earlier. Like I definitely did. I thought I was going to poop my pants and pass
faint.
out. I thought
That
I
was
was gonna.
fun.
I truly
I've got a wheelchair. I'm holding him up and wheeling him down the hallway back to his bed.
I was almost certain I would faint, and then I felt my bowels loosening up, and I was like, oh man, I'm gonna crap my pants and faint in the lobby of the hospital.
And I'm trying to debate because I know he wants every time content for YouTube.
Yeah, should we
Do I
film
try to
it?
film him as he passes out, and then I'm thinking to myself, no.
No.
He's loves drama. If I start filming him, he will pass out.
That's funny. Anything else you think we need to do for the update?
No, that's great. Thanks for watching, everybody.
Yeah, thank you for watching, and I'm assuming we'll make an update tomorrow, and we'll pray for things to continue to go well. I'll stay thankful for the healthcare I have and the support I have, and for you guys, and thank you for letting me share this unexpected part of my life.
Thank you.
Thanks, guys. Bye-bye.